The cells are going to transmit to the other cells, and there is a huge network of lymphatics, the blood vessels, as well as your veins very close to that pathology. And as it looks, over years, whatever studies we have conducted, multiple clinical trials, malignant tumors don't stay where they are. They try to migrate. They have a local invasive pattern and they have a distant metastasis. So when they are invasive locally. What does it mean? Basically, they invade the surrounding muscles, the surrounding nerves, the surrounding arteries, or I'll not say arteries, arterioles and capillaries and venous plexuses, and ultimately they find a way to enter the lymphatics. So lymphatics have afferent and efferent lymph, and ultimately they go to a specific area of the tumor which is drained by a specific node. All right. So once these cells enter those nodes, these nodes try to kill those cells, but unfortunately, as the numbers increase of the cancer or metastatic nodes, that's why they start increasing in size. And then once the nodes are full of these cancer cells, so you have something called as the first echelon node. So every area in oral cavity, in head and neck, basically, when we talk about head and neck, let me tell you, head and neck surgery is a very vast term. All right. So vast term, as in it doesn't include oral cavity and salivary glands only. So it includes thyroids, your parathyroids, your nasopharynx, your oropharynx, your eyelid, orbit, scalp. I mean, anterior skull base, the lateral skull base, and whatnot. So when you're looking at this area, it's a very, very aggressive area. It's a very dangerous and it's a very limited access area. So, for example, if you have a colon malignancy, you have the whole abdomen. I mean, most of the people find it very easy to do it because you have 360. You can move your hands, open the abdomen laparoscopically, or even through robotics nowadays. You can do a lot of work because there's a lot of area to maneuver your instruments. But when you're talking about head neck, there's hardly any space. There are hundreds of nerves, there are hundreds of vessels, there's hundreds of veins, bleeding. Yeah, well, it's not the case when you're talking about major nerve surgery. You have major vessels, but then they're seen very well. The minor or you can say the